All right, and we should be live. Hi, everyone, and welcome back to another session with Dental Shadowers. Today, we're joined by Dr. Gleason, who will be talking about general dentistry. Doctor, thanks so much for taking the time out of your schedule to connect with us today. Feel free to take it away whenever you're ready.
Okay, great. Thanks for having me. Hi, Dental Shadowers. Like you said, my name is Lauren Gleason. I am a general and cosmetic dentist here in Southern California. I graduated from UCLA and I'm really excited to be here. So let's get started. Okay, let me go to the next slide. Okay, so I went to undergrad at UC Santa Barbara, super beautiful, but I actually majored in sociology. I wasn't a science major. I then realized kind of during my fourth year, that I wanted to go into dentistry, but I also wanted to graduate and kind of save money for my parents. So I decided to work after school, after I graduated, and I did a post-baccalaureate program down at USC. So I took a little bit more, the prerequisites for dental school. Took the prerequisites. I worked a lot. It was probably a good thing that I worked so much because it really solidified that I wanted to go to dental school, that this is what I wanted to do. So I worked as a dental assistant. I worked at a dental lab as an office manager, and I was also a tutor. So I was doing all kinds of things during these times. So I got into dental school in 2018. To UCLA. It was my dream school, my number one school, and I wasn't expecting it. I was quite shocked. So, it is what it is. So never give up on that dream. And then during dental school, I was debating whether I wanted to specialize or not. And it was during that time I decided to do an advanced education in general dentistry at the University of Pacific. So I did one extra year and got an advanced education in general dentistry. So I feel I got like a lot more experience and know-how from that. And I felt a lot more comfortable going into the private sector after that, essentially. So, it is what it is. And some people do it and some people don't. It's definitely, up to you. So like I said, I was kind of like a non-traditional pre-dental student. I wasn't a science major. I majored in sociology. I graduated like summa cum laude. I thought I was going to go into law school. I applied to law school. I got in. But I was interning at a law firm in Santa Barbara, the Legal Aid Foundation. And I realized I really liked serving, underserved communities, but I couldn't sit behind a desk all day, and I couldn't, I loved using my hands. I was really into art and I loved science. So it kind of transitioned me into going more toward the dental route. So it wasn't, a straightforward path. And, it's okay if you don't know if you, at this point, whether you want to go to dental school or not, you figure it out, but make sure when you do make this decision that this is what you want, because it's a huge investment. So it's a huge investment in time, social life, everything. So you really have to make sure you're doing what you want to do. And like I said, part of the reason why I transitioned into dentistry and got into that was because I really liked helping people. And I was a dental assistant, not only during my college years, but my mom is a dental hygienist. So I was a dental assistant kind of in my high school days too, just off and on. And the doctor that at her practice that was working there, he kind of saw, I was kind of telling him, yeah, I'm thinking about law school and thinking about this and that. And when I finally told him, you know what, I don't think law school's for me, he was like, you know what, come shadow me, come see what I do. I think this is more like the path for you. He saw how I was with patients, and he's like, no, I think this is more your way to go. Plus I'm not a good liar, and I don't know, there's nothing wrong with attorneys, but it's just more, I have a softer type of nature. So it seemed a little bit more down my route. And again, in college, I was really pursuing this law school. So I was a research assistant for the sociology department. I interned at law firms. So I didn't really have a lot of experience kind of doing that, science type of research, but I did have research under my belt, and the science classes that I did take in undergrad, I aced, but it was kind of, I don't, like I was so young and naive. I didn't know that I was just not confident enough to like think that I could do it. But now that I'm through all of it, it's definitely made me super happy, and it's super fulfilling. And yeah, I just shadowed for hours, I guess hundreds and hundreds of hours, watching dentistry and seeing how it was done. And I realized like I could do it. So that's how I got into the dental route. Okay. And then, like I said before, my mom, she's a dental hygienist. She's been a dental hygienist for, oh gosh, she's still practicing probably 35, 36 years now. She refuses to retire, even though I tell her to. So she's like, she's the only person I let clean my teeth because, I trust her so much. But my sister, that's my younger sister, she's actually way taller than me, and I'm super jealous. But she is also a dental hygienist, and those two work at the same dental practice. And they're the main reasons why I went through all the pain and suffering of dental school and why I am here today. My mom is so strong, and even when I was younger, she encouraged me to do what I loved, and I saw how she was with patients, and I really wanted that type of connection. And she was working during the days when when HIV was like a new thing, and a lot of doctors were refusing to kind of treat these type of patients because no one knew, and my mom, I've known her patients for years, and they would, tell me like she was the only one that gave them compassion and would clean their teeth and would just help them in general. And that's the type of person that I aspire to be, and so that's why I just went down that route. And the reason why I didn't become a hygienist was because cleanings to me are, it's very repetitive, and I like doing, I like to mix it up a little bit. Plus, I like being the boss. So that's another reason. Yeah. And overall, like, I just want to improve patients' health, and I want to improve how they look and how they feel about themselves. So that's why, there's just so many reasons why I got into dentistry, and it's so fulfilling. So I also spent a lot of time in the dental chair as a patient. So I was like, when I was a kid, I was completely terrified. I was like, I would scream. They would have to like hold me down, like all that kind of stuff just for like a cleaning. And it resulted in me. And then I had like 7 years of ortho treatment, braces, just headgear, the works. So I just knew the type of dentist that I wanted to be, just, kind of a nicer demeanor, very, kind of like not aggressive and just nice, and, I feel like these days that's what, patients are looking for, and they want someone who is going to be honest and, all of that stuff. So again, yeah, that's dentistry is great. So here, let me see what, okay. So I got into dental school. I got into UCLA. Like I said, I was not even expecting an interview from UCLA. I was, I had gotten into a couple other schools down in Southern California, but I really wanted to go to UCLA, and I don't know how it happened, but they picked me for an interview and I got in. And, I was also very involved in dental school because I wanted to help people. I wanted to serve the community. So I worked with the HIV education committee for the ASDA chapters. I'm sure other presenters have talked to you about ASDA and what that is. So, it was just really good to see other kinds of dentists being involved in different sectors of dentistry, essentially, and seeing how much of an impact that they can make on patients. And I was pretty involved, but I also kept like a really good balance with family life and schoolwork. But it wasn't, dentistry is not, dental school especially, it's a lot of hours, it's a lot of time, and you have to be ready for that, So these pictures here, the one on the lower left side, or this is one of my favorite patients that I treated at UCLA. She would she was so sweet and so nice. And she would come with her little therapy dog, and he was like a 3-legged therapy dog, the sweetest thing. And I did a denture for her. I did a few fillings for her, and her smile, she didn't want me to graduate because she, me and her connected so well. And this was my second year at the time, and I, mentored her into, helping her with this patient, and she loved her too. So yeah, and this is me just chilling in clinic with our ugly blue scrubs that we all hated. But we had fun too. So that's the thing, it's a lot of work, but you meet really good people, and some of my best friends I met in dental school. So yeah. So after dental school, I decided to go to University of the Pacific residency. It's an advanced education in general dentistry. And that really prepared me for more comprehensive cases. And by comprehensive cases, I mean full mouth rehabilitation. Like, they come in and they haven't been to the dentist in 15 years, and and they want to reconstruct everything. And it taught me a lot, and it taught me different sectors of dentistry more. So like I learned how to do root canals a lot better. I learned how to place a few implants. I did some gum cases where I did crown lengthenings and bone augmentation. I'm going to show you a case later that I worked on. It was probably one of the most difficult cases that I've worked on. And not only that, I chose to go to this residency because they also served special needs patients, autistic patients, patients who really couldn't handle being in the dental chair, either due to health issues or, especially with people with special needs, they can't handle bright lights, they can't handle the noise. So in cases like that, what they would do is essentially bring them to the hospital, put them under general anesthesia. And that's me right there. You can't even tell it's me, but that's me. And I'm, pulling some teeth, and you do some fillings. And sometimes what you have to do eventually is pull out all their teeth because they're so decayed or so infected. And they're in so much pain that they can't eat, that you pull out their teeth and give them dentures during this procedure. And, it's after that you check on them, and they, their caretakers or whoever, they're usually pretty grateful, because then they're not, these people who can't really express how much they're in pain, like they could eat again, they're a little happier, things like that. And, we also served, like lower income communities where, we would just treat kids, and, it's all for free. And, we do fillings, all those little things. And, just seeing the gratefulness of patients and doing that, it just really, warms your heart, and, all of that. And it kind of reminded me again, like why I got into dentistry and why I did the things that I did. Yeah, but I would say the OR cases, if you ever get that kind of opportunity, they're so fun, and it's really awesome, because you're truly like helping someone that really needs it. So it's really good. Okay, so currently I am an associate dentist, and that means I work for another dentist. So I'm an associate at 2 different practices. One practice is in Irvine, California, and it's called Lydon Dentistry. And then the other practice is Diamond Bar Dental Studio, and that's in Diamond Bar, California. So I work about 4 to 5 days a week. I was working 6 days a week before the pandemic, and I do not suggest that. It was basically, I had no life, and it was kind of wearing on me mentally. So I decided to cut back after once we started working during the pandemic. And then now I've just recently kind of decided again to only work 4 days a week. So, it's just a lot better. It's a better work-life balance for me. And the owner dentists are very understanding of, my situation. And it's just been, you got to find a good fit when you're an associate dentist. And these 2 offices are the best fit for me. And I'm also involved in, other aspects of dentistry. Like I'm a member of the California Dental Association. I'm involved with meetings with Orange County Dental Society and the Academy of General Dentistry. I'm trying to become a fellow of that. So, there's different aspects that I just try to keep involved and keep educated. And then Seattle Study Club, that's another thing where I'm constantly learning new things and new techniques. And it's just great to have these kind of in your background. Okay, so the first practice, this is Lydon Dentistry. We're an all-woman team. It's really awesome. Dr. Lydon, she's right here. The shorter one, I think I'm the tallest one in the group, which is rare. So we're we all get along super well. Her office is really kind of a relaxed vibe, very clean, very nice. And, her staff is really attentive, so nice. And she's becoming a mentor to me, and I really am super appreciative of this opportunity that I've had, because I really applied to her position on a whim, and we just clicked like immediately. And so she's kind of been taking me under her wing, and it's been it's been a really good learning experience. Even after you graduate, you're still learning a lot, and this is her operatory right here. This is one of the operatories I work at. She has this nautical thing going on. So, and she always has top of the line kind of materials. That's we show this to patients. It's, their full mouth x-rays. She has an electric handpiece. She places implants. We kind of go over everything together, and she does a lot of full mouth rehab cases. And one of the reasons why she hired me was because I had that experience with my residency, and she does a lot of cosmetic cases too, as well. So I'm there every Monday and Tuesday, and then Fridays as well. Okay, and then Diamond Bar Dental Studio. That's another office that I work at. I'm sure you know this guy. He lectured to you guys, I think last week, But this is Dr. Cho. He's also one of my mentors. I also kind of started working for him, kind of on a whim. I was talking to him. We were friends in dental school. He graduated a few years ahead of me. And I was kind of just talking to him about my current situation. He's like, you know what? I know how you work. I know how I know your mindset. Come on board. And so, he is, he's super smart. He knows so much. And it's just really cool to be working for two dentists that are so comprehensive and just do so much. And they're essentially super dentists. They do almost everything. And that's the type of dentist that I want to be eventually. And so his practice is a little bit more kind of, it's a local practice. Patients have been coming there for years and years and years. The kids have grown up in the practice, and he does a little bit more Invisalign than my other office. So it's cool learning that aspect as well. My other office in Irvine, they do more traditional ortho, with the braces and the brackets. So it's just, really awesome to see these different things and see how I work. And, I'm, figuring out what's working best for me, because I am a fairly newer dentist than, compared to my bosses. So it's just been, it's been good. So what is general dentistry? General dentistry is where you're going every 6 months to get a cleaning, to get an exam. We are your primary dental provider. We are kind of like your home base, we tell you, we check for everything, not only with your teeth, but with your health too, and with everything that you have going on. So it's just more of you go there, it's like a checkup that you get every year from your doctor, and it's just for your overall health. Okay. The type of procedures that I can do personally, I'm doing all kinds of things. Exams constantly, fillings, crowns, bridges, that's the basic stuff. I'm doing that all the time. Implants, I'm still learning, I gotta be honest, I'm still learning how to, place them how my owner docs are placing them, but I'm getting there. And, eventually I'll transition into their types of things, but I'm still learning. And full mouth rehab, I do full dentures, I do implant supported dentures. I love doing extractions. If I wasn't as old as I was, I probably would have gone to OS, I've gone into OS more, but I've done extractions, bone grafts. I love doing Invisalign. I do deep cleanings, I do gum grafts. And then another aspect of dentistry that I think some dentists don't touch upon is TMJ and your joint. I have been very heavily educated in how important that joint is to your well-being, to your teeth overall. And I fabricate splints for patients. I help open the bite if their bite is collapsed. And I create mouth guards, not only for sports, but, for every night. I'm a clencher and grinder, so I wear a night guard every night. And it just protects overall long-term your joint, the muscles in your face, and everything. It prevents headaches. It prevents all kinds of things. So this is kind of TMJ, the TMJ, TMD stuff. That's more newer science. And so some older dentists are kind of skeptical of it, but the more research that's done and the more that, is studied, you just realize how important this joint is right here. So every time I see a patient, I'm always doing an exam on them. I hold right here, both sides, and I feel how their joint is, you could feel everything. You could feel if it's cracking, you could hear popping, and I'm like, it's kind of a weird, I'm like, I have my ear up against them, and they're like, what are you doing, weirdo? And then, you do this, and you could tell that, for my case, I could tell that my kind of joint makes my jaw deviate to the left. And so for me, I have more issues on my right side because I'm using more it's a whole complicated thing. And, you kind of learn this stuff in school, but anyway, it's super fascinating to me. And my practice, when I own or partner up with these guys, like, I'm going to really focus in on this stuff because it's super important. Okay. So in a typical day, I'm usually an early bird. I get there about like 30 minutes early. I'm reviewing my charts. I'm seeing what patients are what, if there's any confusion in the schedule. I'm seeing if there was, miscommunication, or if if a crown is ready to be delivered. I'm checking to see if it's back yet, and, because you don't want a patient to show up and have the crown not be there. That's embarrassing and it looks very unprofessional. So doing that, doing some paperwork, that's my morning. And then usually our hygienists are there, they start their cleanings, and I'm bouncing in and out of rooms doing exams. And that's when I really get to talk to patients and see how how their lives are going, what their concerns are, things like that. And my hygienists are really good about updating me on what's bothering them. If there's been any changes, they note it in the chart, and it's really great. So I'm just constantly being passed and forth. It's like ping pong over there. So at the end of the day, I'm kind of, sometimes I don't have enough time to write everything down in my chart, or I don't have, time. So by the end of the day, I'm reviewing the charts for the next day, but I'm also calling patients that I had worked on a couple of days earlier. I'm, doing insurance stuff. I'm doing all kinds of, things for the charts and all of that. So, and you just never know sometimes what's going to walk in the door. Sometimes you have a patient just walk in, they don't even call ahead, and they're just in pain, and you got to deal with it right then and there. And, sometimes it happens and it puts you an hour behind, but you just keep going and you keep doing it. And yeah, there's never a dull moment. That's why I love it. It's, I'm constantly trying to figure things. Sometimes I feel like MacGyver, like I'm just, trying to figure out oh my gosh, this filling is so deep. And then I can't get I'll show you the little tool that I use. I can't get it quite so that it's covering. So then I have to use Teflon tape to do this. And it's a whole thing. And I'm like, good thing when I was a kid, I was so good at Legos and stuff and figuring out all kinds of things, because otherwise, I don't know sometimes I don't know how people do it. So it's just, it's fun, and you're solving problems, and I love it. So let's go on to the next slide. Okay. So again, this slide is so funny to me. Every time I see it, I laugh. People have all these perceptions of dentists that all we want is money, and, we're crazy, and that, it's all that stuff. And then really in the end, that last one, what I really do, it's literally, that's what I'm doing. Whenever I'm curing a composite, I'm just looking around, seeing if there's, like what else is going on, like just thinking like, oh, I wonder what I'm gonna have for lunch today, or oh, like what's on TV, or what I'm gonna watch on Netflix later. So, like, and then my mom, she's always so like, she thinks I'm like a doctor, but I'm, it's like, yeah, I'm a doctor, but I'm not like Dr. House or whatever. So yeah, and my friends just think, all my friends have been in the tech world. They work for Facebook, they work for Google and things like that. So they just think, oh, I'm making money, all this money. And I'm like, no, but the student loans, no, but like actually insurance takes a lot of your money away. And then, all this stuff. Really though, it really is about the patients for me. And so that's why for me, I don't care like, what a procedure costs. I don't care if I'm not making any money off of it. I don't care. I don't care at all. All I care about is that the patient comes in, like leaves the office in a better situation than they started off in, or they're more educated about their mouth and their health. And that's all I really care about. So I'm always listening to what patients have to say, even if like they think, some patients I always get like, oh, I'll tell a patient like, yeah, you need a crown or a bridge. And they'll say, oh yeah, is that to pay for your car? And I go, no, it's not to pay for my car. This is, so you can eat, but like, yeah, cool. I guess I could pay my bills too, right? I go, no, well, it's to help pay my student loans, but that's it. So yeah, this is me at one of my offices. And yeah, again, like this was before COVID. So, I used to not wear a mask when I was talking to patients because I really liked making a connection. But now, I always have to, now they don't even know what I look like. They just see like my eyes. And it's been kind of a transition working with patients after COVID because, they're really only seeing your eyes and they don't see the emotion that you have with your face and the expression. So, I've been adjusting to it, but it's been getting better. And patients, I think, understand too that, they do have to come in, even though the pandemic's still going on, because it's just been a way of life and you can't ignore your teeth forever, so that's that. And, patients that come in, usually they are coming in, a lot of patients just come in for an appointment and they're like, yeah, I need a cleaning. And this, I'm only here for a cleaning. Or some people come in with, I want to fix my mouth. And other people come in saying that their jaw hurts, because some people seek me out just for jaw pain. And then some people, my favorite one is, I haven't been to the dentist in a while. And then I always say, well, what's a while? And that's always like a scary thing. And you look over at the x-ray and you're like, yeah, you haven't been in a while. I've had patients that come in that need clearance for surgeries, especially for joint surgeries and things like that. A lot of medical providers, surgeons don't like working on patients until they know that there is no infection in their body. And a major infection that we all have is gum disease. And so at the very least, I have to make sure that no active infection is going on. And, the last one patients try to like get away with is like, oh, I hope I don't have cavities. But with this pandemic and everything, I've seen a lot more patients break teeth, a lot more cavities, a lot more root canals. So it's been interesting. So basically, when I see a patient, I have like a set way that I do things. I always have the x-rays up, and I always have my basic cassette here. So the mirror, like a perio probe, and a little explorer. I also have like this little thing, it's called Typodont, and you get these in dental school. And I, usually have a toothbrush, or I show them things. It's more of a teaching tool for me. These things right here are mirrors so that I could take photos of patients' teeth. So I'll take photos and I show them what the issue is, and I show them on the Typodont. And the number one thing that I cannot, do dentistry without are loupes. So these are your lights, your magnifiers. I don't want to break my neck. I'm not, I want to be in this career for at least another 20 years, 30 years, right? So I need these to see things up close without, going all crazy. Although sometimes you do have to do that, but this is like my number one thing. And it's, it's helped me find a lot of things that, I think some people kind of miss. So this is super important. What you have to know about loupes though is they're expensive, and you should get just save up for it. You're going to have to pay for it in dental school. They make you get loupes in dental school. They're at least $1,500. So, keep your dental school loupes as good as possible. And then before you graduate dental school, buy another pair because it's 50% off. Once you become a, full-on dentist, they don't give you the discount anymore. So that's what I did. So I have 2 pairs of loupes just in case one breaks, which one did like a month ago. So I had to use my old dental school pair of loupes. And, it was, thank goodness I had it, because otherwise I would have been, I would have had to get some more massages. So another thing that I need, we talked about dental radiographs. So here on this laptop, we use digital radiographs. We don't do any of that traditional type anymore. Digital radiographs, they emit a lot less radiation than you get like going out into the sun. So this is a full mouth x-ray. I take full mouth x-rays every 3 years. And that's usually what insurance covers. And full mouth x-rays, you could see everything from like the tip of the tooth there, you see everything. And then you see bite wings to see the bone loss and see if anything has progressed. And I'm always comparing, last year's x-rays to this year's x-rays to see if, things have been progressing, if things are getting worse, better, whatever. So regular bite wings, these we take every year, these ones down here in the middle. The ones around there, we take, every 3 years, okay? So I always have to have x-rays, and patients sometimes will ask me, how much is this gonna cost? But I honestly, I need them so much. Sometimes I was like, you know what, I'm not gonna charge you for this. I just need it so I can properly diagnose you, So, and some patients are very concerned about the radiation. I just had a patient come in the other day. There was a patient that was pregnant, but we had to get an x-ray, and, she had doctor's clearance, but, you have to be kind of cognizant of that. And I had to explain to her, the radiation is a lot less and blah, blah, blah. So that's that. Okay. The number one thing that I do are fillings. Okay. And fillings are your bread and butter. You're going to be doing them a lot. So in dental school, you got to get really good at them, and you got to get, they could get kind of annoying sometimes. I'm not gonna lie. Sometimes it's super frustrating and you wish you would have done a crown, or you wish you would have done an onlay, but sometimes you want to help someone out. So I use these little matrices here, and that helps, make it so that it's shaped like a tooth. And sometimes these things are really annoying to get to fit into things, but I love it when I take an x-ray afterwards and the filling looks perfect. And I'm kind of like, I'm a little bit of an artist, so I tend to take things slow and I make it really, really look pretty, sometimes almost to an obsessive point. So that's just me. And then that's the curing light you use. And then there's like specific, you have to cure the tooth for so many seconds around the whole tooth. And then a major thing for me is I want the tooth to match with not only the tooth that I'm working on, but the teeth around it. So I use a shade guide. And so you just kind of bring it up to the patient's face, and you see like, okay, it looks like it's between this shade and this shade. And sometimes I'll mix the shades together, so it looks really good. But this is like a really important thing to have. I just don't like guessing, and I want it to be exact. So that's what I go for. Most patients, B1 is like the shade most of your patients are gonna want, even though they're like a really dark color. So you got to convince them to go with the more natural color. Okay. Another thing that I use that I think is really cool, it's called a MicroEtcher. So after I do a prep for a filling or a crown or anything like that, it pretty much has sand like in this little thing, little granulated things, and you spray it on the tooth before you actually, put the filling in, and it helps the adhesive work better on the tooth so that the filling can stay longer and stronger, essentially. And it's kind of a mess. So you have to make sure that the patient is wearing like goggles, and you're wearing goggles, because the sand gets everywhere. One time I had a patient that it looked like it snowed on their face. So it was just, but I had to do it. So that. And then another thing I like using, it's called a Diode Laser. My hygienist also uses this a lot. It helps with gum healing. It's a little laser that you get in there. Helps the blood to start to clot, but I like using it too for when I'm doing a crown prep or a filling, if the gum kind of is overlapping on an area, I'll cut away at the gum a little bit and there's no blood and you're able to fill it a lot easier than using, there's another chemical thing that you might have to use, but I like using this a lot better. And sometimes, you know, you can use it for whitening, you could use it for TMJ pain as well. So this is like a very versatile thing, this laser, I love it. To do fillings, to do crowns, you always have to isolate. Okay, so everyone's favorite tool in dental school is the rubber dam. It's honestly, I'm glad I have assistants now, because in dental school, you do this all on your own. You just have to cut the holes out and you put it on, the clamp and everything. And this is to keep things isolated. This is to keep things clean from the patient's saliva getting in. Now they have these new things called isolites, and it's the same thing. It pretty much keeps the tongue out of the way. I use isolites more than I use rubber dams, but I do use rubber dams if the patient has like a gag issue or has asthma or something like that. I would use a rubber dam. That way they can breathe a lot easier than with this, because this literally is a mouthful. Like some patients get so overwhelmed that they can't handle it. And sometimes I use really small ones, like the kid size ones, and they just don't want it in their mouths. They feel like it's too much. But if the patient is able to tolerate it, this is great. And it even has a light too, so it lights up things and it makes things a lot easier to work on. So another tool I like using, especially for nervous patients, is nitrous. This is me when I was in dental school. We did nitrous on each other, and my friend embarrassingly took a video of me, so I'll play it for you guys. Hopefully crazy. So yeah, if you have a really annoying patient, just give them nitrous, and then they'll be in their happy place. So there you go. Now for crowns, and that's what's called indirect restorations. I use this kind of tool set here. So I use either a high speed, either electric. I mostly use electric, but yeah. And then you have your burr blocks here. And then this is to help for the little cords here to help retract the gingiva. Like I said, you could also use that laser that I was talking about, but this is something else to use as well. It's another tool to utilize, and it kind of, right here, you can see my crown preps. You pack it in and it keeps the tissue out of the way, so you could get a really good impression so that a crown is able to exactly match that. Okay, so it's, you know, there's so many tools, you know, that we have that we can do such great work with. So, you know, for me, there's like no excuse to do like bad work, you know. And this is a crown that an onlay that I did. So that's the prep that I did. And then I packed cord down here. And then I took an impression here, that's it. And then that's delivery, okay? This is before I polished it, so it looks kind of grainy right there. So I wish I would have polished it more, but you know, this is, you could do great things with that, so. And this, you know, the patient originally wanted a traditional white filling, but you know, I was starting to take things out, and I said, listen, like this is going to be too much as for filling. And, you know, I had to take this is the picture I showed them essentially. And they were like, wow, that's like half my tooth. So I said, yeah, I think we should go for an onlay. And they chose gold because that's so compatible with other teeth. So, you know, it's all about patient communication and just being open and honest with them about, you know, the type of quality work you do and how you want it to turn out. Okay. So yeah, that's another restoration that I did. I love doing extractions. I don't know why, I just love doing it. And so this is a tooth I extracted. It was super infected, just not restorable. I wish I had the before picture. And so I took it out, and then the bone here, I smoothed out with like a little file. I smoothed it out here, and then I placed a bone graft. And I sutured it up. This is called a horizontal suture mattress. And I waited for it to heal. I waited about a good 4 months, and the patient wanted an implant. So we placed an implant there eventually. But this was, you know, something that I really liked doing. So, you know, a lot of dentists now, especially a lot of general dentists, are getting into implants. So I feel like we should talk about it. Everyone needs a CBCT. And a good, you know, we need a good 3D plan of what's going on, because you always go in thinking you need the restorative plan first, essentially. So you need this to plan things out, okay? So this is the one we have at Lydon Dentistry in Irvine. And this was a case that I had, a little while back, and I had a lot of help with an oral surgeon and another dentist. So, you plan out where the implants are going to be placed. And this right here is where the nerve is. So you need to make sure you're not placing an implant to the nerve because that's very bad. And you see how much bone they have and things like that. And it's super cool to plan out. So that was a patient. Yeah, so this patient, I'll show you in a second, but she needed 4 implants. So we'll go from there. And another tool that I have that, is just being utilized more recently is a centrifuge. You take the patient's blood and then you do the centrifuge and you essentially put whatever is the platelets back in with the bone graft, and it helps with the healing and it helps with implant healing as well. So this is something I use at both my offices. Okay, so this is a patient that I had. It looks like this was 2018. This is like one of my first cases at a dental school, so super overwhelming for me. But thank goodness I had a lot of help. So as you can see, there's a lot going on. Cavities all over the place, non-restorable teeth. Patient was in pain. It was just, kind of a tricky situation. She was about a 50-year-old woman. She was a smoker. Just kind of she was so afraid of Alexander, she just let her teeth kind of get to this point. And it got to a point where it looked like this. Her bite was collapsed, and her main complaint honestly was, I want to take all these teeth out and I want dentures. And I said, okay, well, let's not be so drastic, but definitely what ended up happening was all her lower teeth, see all this decay here, and then the crowns underneath where they were not doing well either. So we decided the restoration should be an all-on-4. So an all-on-4 is a denture with implants underneath so that the denture is locked in place. Because her concern was we planned for all-on-4 on both the upper and bottom, but I ended up only doing the bottom, and then one of my friends ended up taking over the top. So we decided, we took out all the bottom teeth here. Sorry if this was graphic, I probably should have warned you. And then I measured the bone to see how much we needed. And then we smoothed out the bone here so it looks all smooth. See how it's jagged here? Now we smoothed it out. And then we used a surgical guide that I created and we placed these implants here. Okay. Then I did not want the patient to go home without bottom teeth. So I had a denture pre-made for her. And we fabricated it. We ended up fabricating it to the implants. So we had to take like some impressions, we had to add more acrylic and then just make it so that it was a semi-comfortable fit for her. It wasn't going to be completely perfect. This is not like the last final restoration, but it was going to be, something that she could have to at least eat something, smile, things like that. So that was her temporary prosthesis with the implants in place. Okay, so obviously that's a lot better situation than she had before. It's not, to me, this is still not perfect. And her final restoration, I ended up not taking pictures of it. I don't know why, but it ended up looking super fabulous. Okay, so like I was saying, dentistry is something that is very meaningful to me because you could change people's lives like within an hour, and it's something that is very just like, I think very gratifying. And so I'm going to talk about a couple of, patients that really kind of affected me in a way that it was very emotional for me as well. It was very gratifying. Okay. So every year, the California Dental Association hold these events, and it's like a couple times a year. And it's pretty much free dentistry for people who can't afford it. And these people wake up at 2 a.m., 3 a.m., they get in line and they need help with their teeth, but they just can't afford it. So I volunteer pretty much every year since I've been in dental school. I've helped out in some way at CDA Cares. And this in 2019, I got on TV. See, that's me. I know you can really tell it's me. But I was working in the prosthesis department at that time. And these were patients that they were trying to get jobs. They couldn't because, some of their teeth were missing, or they just were in so much pain that they needed a denture, all that kind of stuff. Right. So This one particular patient that I happened to help, he was telling me, here he is. So, he's a fairly younger guy, but just kind of came on hard times, and he had gotten in line. He was telling me he's been here. He was like in line since like 4 o'clock in the morning. He's been trying to interview for jobs, but every interview he went on, he was just getting like, like kind of shot down because his front teeth were missing, and people were like, "What's wrong with you? Did you get in a fight? Like, what happened?" You know what I mean? And we were able to fabricate this the same day. You could see that little clasp that's going around the tooth there. And we delivered it to him, and he started crying because he's like, I could finally get a job. I could finally smile and be comfortable about it, and he was like saying that it was so hard for him to even, eat and all of that. And so for him, I hope he really did find a job. And I hope, for me, it was very fulfilling, and like I was so happy to just do that within the time it took us to fabricate that and to adjust it. And he was so happy, like at the end he was just like, he was in tears. So it was just kind of like something that was super touching. So okay, another patient that I had, this was like involved with a lawsuit. No dentist would touch him, but he came to my residency program, and he happened to land on my schedule. And he was in severe, severe pain. And I'm going to get to the slide in a second. Essentially, I became like a witness for this case, but he came in like this, and it was shocking. Like to me, like I didn't know what to expect. I just saw him on the outside. So I said, let's take an x-ray to see. And this is what I saw. The case is over now, so I could talk about it. You could see here implants are in his sinus. That's so painful, so painful. And they honestly, it looks like someone went to Home Depot and like put some nails in there. Like that's what it looked like to me. And these wires, and it just was terrifying to me. And he was like literally in so much pain in the chair. And so, we took we took all this stuff and just saw where it was, and you could see it. That's all in the sinus. So it was super painful for him. And this is how it looked in the mouth. Infections everywhere. Everything was loose. Everything was just, he couldn't even eat. At that time, he told me he had lost at least 50 pounds because he couldn't eat. And then he couldn't leave his house because he didn't want anyone seeing this. And this dentist that had treated him just apparently disappeared. So there was no one to help him. So he came to my residency, and ended up here, and with some guidance from my program director, because I really wanted, some people were saying, oh, don't help him because, this is like a lawsuit. And I'm like, well, it's a lawsuit, not for me. Like I didn't do this, right? So I decided, you know what, like the very least I can do, and I documented everything. I had to take so many pictures. I had to write very careful notes and everything. And so what I decided is like, you know what, these implants aren't doing you any good. We have to take them out. And I think you have to be in a full denture for a while. And then eventually when you heal, you could do like an all on four, that what he really wanted, but I don't know what happened here. So that's what I did. I took out these implants, took them all out, sutured him up here. And then, honestly, these implants were very easy to take out because they were so loose. But after that, I delivered him a denture. This is like an immediate denture, so it didn't fit quite as perfectly as I would liked it, but we did a reline. That's the scuffed up material there to help it fit. And that also acted like a bandage so that it would, help his bones heal so that we could place implants later on. So that was the denture that we placed there. And so after that appointment, we're still in contact, me and this patient, and he's doing so much better, and he's put his weight back on. He looks a lot more healthy, and he finally got there because I graduated from residency at that point. So he had got the restoration that he fully needed. And he said, it was just, he had thanked me for, kind of like listening to him, and just helping him in that aspect. I even felt guilty giving him a denture. I wanted to, give him something more secure, but, at that point, it just wasn't time for that. So, yeah. So yeah, that's the before compared to the after. I mean, obviously it just looks so much more natural. it just, the infection's gone, you know, and something, this was one of the cases where I'm like, yeah, this is why I became a dentist. This is why I want to do what I do. And so, yeah, because, you know, you have patients that come in that just want whitening or just want this and that, and that's great, you know, but like something like this where it was truly hurting the patient, like health-wise, is something that is truly inspiring. Okay, so that was like, I know there's a lot of information, a lot of crazy stuff. So my biggest advice for you guys that are thinking about going to dental school is, one, really make sure you want to go to dental school, because it's a huge investment. I just heard, I think NYU is going to cost up to like $700,000 to go. I know USC costs close to $600,000. You know, you gotta be really, it's a huge investment. And the only way you're going to figure out if you really want to go is if you shadow, if you assist, if you just kind of talk to other dental students, see what their experience has been like in school, what you want to do. If you want to specialize, like UCLA is known for having a lot of applicants that end up going into residency that specialize. So I think about 50% of my class went into some type of specialty that included orthodontics, root canals, oral surgery, periodontics. And then half of us went into general. So you have to, you know, kind of see what kind of route do you want to go to. If you know you want to specialize, maybe go to a school that kind of is more research focused and more into that, you know. And then like for me, I was super appreciative of the gap years. I took a couple of gap years that I took and just worked and saved money to kind of figure out, is this really what I want to do? Is this really something that I could dedicate my time to, that I could handle? And so I was grateful for that. And it gave me a lot of perspective. And I think I matured and got a lot more confident over those couple of years anyway. So that was another thing. And then another thing, you know, just be well-rounded, just kind of, you know, like, don't forget to take a break every once in a while. Like, you know, if you're studying so much, and like, don't forget to like, you know, go outside. Don't forget to have fun with your friends. Don't forget any of that, because, you know, you know, you got to keep sane. And that's how I kept sane. You know, I always, you know, granted, I sacrificed a lot of time, but I kind of always had to pencil in times with my friends, my family, and things like that. And I ended up talking to UCLA, the admissions committee, like sometimes there's students on there, and I talked to one of the upperclassmen that was actually on my admissions committee, and he remembered my application. And what he said to me was, you know, like the reason why they picked you, the reason why you kind of, you know, got in was not only because of the stats, but you were the only person who was a non-science major. You had different perspectives, and they like that. You know, they don't want just someone who is all like kind of has the blinders on and only has dental school in the mind. You have to have other kind of hobbies and things like that. So, you know, just do what you love doing, you know. Okay, and that was it. Thank you guys for having me. And this is my contact info. Feel free to ask me any type of question, anything. Nothing is too stupid. Nothing is too ridiculous to me. And then that's my Instagram. And yeah, you could look me up there too. You could always message me on there too.
Amazing. Thank you so much, Doctor. That was a fantastic presentation. And I really appreciated you sharing, you know, your story and a few of your clinical experiences and cases. At this point, I'll hand it off to our chat moderator so we can go ahead and answer a few questions that were submitted by our viewers in the chat.
We do have a couple of questions. So
Great.
The first one would be, what kind of special precautions do dentists take in order to protect themselves from extremely infectious disease?
Okay, so especially with COVID these days, it's been kind of like a interesting kind of year for this, actually. Precautions mostly are, you have to wash your hands before every patient. So there's like a certain protocol that you have to do, washing between every finger. It's almost like a surgical scrubbing that you have to do. That's the main thing. The other thing are masks. With COVID and the shortage on supplies, at least you need like a series 3 mask, but an N95 mask is obviously kind of the best way to go. now that people are getting vaccinated, I've been wearing N95 since before COVID, so that's how I've been taking precautions. Another thing is, before COVID and after now that I'm seeing this, is I don't wear street clothes into the dental office anymore. So what I do is I have specific shoes that I wear. This all sounds kind of crazy or type A, but if you think about it, it's really gross. So I only wear specific shoes to my office. I take them off in the car, so I'm not taking it into the house. And I only wear scrubs. I used to wear dress attire, but just because, people always would think like the number one question I would get as a dentist is, how old are you? You know what I mean? And, I'm in my 30s, but like people are still asking that, right? So I would dress a little older to look older. But then as the pandemic started happening, all of that, I just have a specific now set of scrubs that I wear. And I usually tend to change at work, and change my shoes and all of that, just so I'm not bringing it into the house and things like that. And then another thing is we wear, and I've always worn like some type of covering. So it's usually like a gown of some type. And they give you that in dental school. That's all we wore, were gowns. So you just wear gowns, and then we wear a shield as well. Yeah, we look like astronauts or beekeepers these days. So yeah.
The next question that we have is, what is the curriculum like at UCLA? Is it clinical focused or problem-based focus?
UCLA is pretty academically focused. So with the new dean, I believe they're changing it up. When I was there, we were really into didactics, like hardcore upper graduate science courses. And we split that time with lab work and clinical time. Now what I've been knowing from some like of my underclassmen and some of my friends down there, they've kind of switched into more hands-on work. So they send them to underserved communities, to clinics and things like that. So they are getting a little bit more experience in that realm. So I would say, but they're still you take a lot of science classes there. So yeah.
The next question that we have is, how did you like your professors in dental school? How helpful did you find them?
Some of them are great. Some of them I still talk to. Some of them are my mentors. Some of them, I'm not going to lie, one of them made me cry one time, but that's okay. Some of them are really tough. It depends on your personality, their personality, and every professor has the right intention, I believe, and it's to make you a good dentist. But some of them come off a little meaner than others, and some of them are super, super nice. So it just depends.
How many different types of dental procedures did UCLA require their dental students to do to graduate?
Pretty much everything. So we had to do, we had to do extractions. We had to do root canals on, molars, premolars, front teeth. We had to do gum surgeries. We had to do crowns. We had to do, we did that. I think a lot of schools, they don't do it anymore, is we did a lot of dentures and prosthesis, like removable dentures. We did a lot of those. Implants, we did some, and fillings and cleanings, yeah.
How much of a role did UCLA play in helping their students decide their specific paths in dentistry?
I think they do a lot of that. Because the class size of UCLA is so small compared to other classes or other schools, I believe our class size is like 70 something versus like others, it's like 100 or something. So the people there tend to get to know you on a very personal level. And so once you kind of figure out what you want to do, you kind of seek out the person that you want to do. So a few of my friends went into orthodontics, and they have an orthodontic department, and they would do research there, and they would have people helping you apply. They had clubs that help you kind of go through the residency application process. They, for every one of the specialties, like periodontics, oral surgery, things like that.
Are the classes for first year of dental school more like undergrad?
No. There are, some of it is, some of it's a little bit of review, like biochemistry. I would say my most difficult class that I absolutely hated was pharmacology. But that, I would say, like, I studied a lot for my, prerequisite classes, but it's not the amount of studying, it's the amount of time that you have to study, essentially, because you're not only taking these didactic classes, you're put in lab too, and lab you need to put in the hours of practice to do that. So it was more of a time management thing. It's not that the material was complex per se, but it was just more like, I just remember, like, I go to bed pretty early. I'm old, so I would go to bed at, like, my normal bedtime was like at 10, but in school I was probably averaging, like, and this is for me is not good because, like, I need like 8 hours, but like 6 hours, 5 hours, and because I had to study for the quiz. We always had quizzes. We were constantly being tested, and so it was just, and we were taking classes on classes on classes on top of lab. So it's more about time balance, time management.
I think that's all the time we have for questions today. Thank you for taking your time to answer all of those.
Oh, no problem.
Yeah. On that note, I guess, no, thank you for sharing. On that note, we'll go ahead and conclude today's session, Doctor. That was fantastic. We'd like to thank you again for your time, and we'd like to wish you a productive year. Thank you again.
Okay, thank you.